This video introduces general observations of neurologic status and then focuses on examination of the cranial nerves, including assessment of the motor and sensory portions of cranial nerves 1 through 12, and examination of the sensory system, including assessment of pain, temperature, light touch, and vibratory sensations, as well as position sense and discriminative sensations. In this video, the examiner will assess a healthy patient. Your patients may have the same normal findings or may exhibit normal variations or abnormal findings. Next, assess vibratory sensation using a lightly vibrating low-pitched tuning fork. Place the vibrating fork firmly over the distal interphalangeal joint of a finger and ask the patient to tell you what he feels.
Vibration.
Ask the patient to tell you when the sensation stops. Then stop the vibration.
Stop.
Now test the other side. Normally, vibratory sensation is intact distally. If it is diminished, proceed to more proximal bony prominences, such as the wrist and elbow.
Once again, tell me what you feel.
Vibration.
Tell me when it
When
stops.
assessing vibratory sensation of the lower extremity, start with the big toes. Compare
What you
sides.
feel.
Vibration.
If vibratory sensation is diminished, check the ankle, patella, and iliac crest. Keep in mind that distal vibratory sensation may normally decrease with age.
I'm going to move your toe
For the next
up
part
and
of the
down.
exam,
I'm gonna
test
practice
position
one first.
sense. To do this, hold the sides of the patient's big
This is
toe
up.
with your thumb and index finger.
And this is down.
Avoid touching the other toes.
Now, can you
First,
tell me up
move
or
it
down?
up and down, identifying each position as the patient watches. Next, ask the patient to close his eyes and identify the direction of motion. Then, move the big toe up and down in an irregular sequence. Compare
Down.
with the big toe on the other foot. In a similar fashion, test position sense in the upper extremities using a finger on each
Down.
hand. Begin the sensory examination by assessing pain sensation in the arms, legs, and trunk. To do this, use the sharp end of a safety pin or other suitable tool. Ask the patient to close his eyes.
I'm going to touch you again.
Then, starting with the arms, test scattered areas, occasionally substituting the blunt end for comparison between sharp and
And
dull.
I'd like you to say sharp or dull.
Then, compare
Sharp.
sides and distal and proximal areas.
Dull.
Complete the
Yes.
evaluation of pain sensation with the legs.
Same as this.
Yes.
Okay. I'm going to bring your gown.
Next, test the anterior trunk. If you detect any abnormalities, evaluate the posterior trunk.
Okay. Keep your eyes closed again.
If pain sensation is abnormal, test the patient's response to temperature.
Hot.
I'd like you to keep your eyes closed, and I'm going to touch you again with the cotton. Say now when you feel it.
Assess light
Now.
touch with a cotton wisp.
Now.
Check the patient's
Is
trunk.
this the same as this?
Yes.
Is this the same as this?
Yes.
And say now again.
Now.
Arms,
Now.
and
Now.
legs.
Now. Now.
Is
Compare
this
sides
the same as this?
Yes.
Is this the same as this?
Yes.
Is this
and proximal
Same
and
as
distal
this.
areas.